So I guess I'm the, patient representative in all of this stuff. So I'm going to talk to you today about patient-controlled, and you'll notice my title on my slide has become slightly different because as I thought through the presentation, I realized that saying just patient-centered was not enough, that actually the point is that patient has to control their data. So let's see how that goes. So I'm here with two hats. The first hat is an active cancer patient and patient advocate, and I think that's my biggest hat. But my second hat is that I'm a professor in computer science, and so I'm trying to bring my expertise in computer science to the problems that I see for cancer patients. And you guys all have your charts of what your organization looks like and your treatment networks look like and so on. But this is my treatment network. This is what matters to me. It's 36 square kilometers in Montreal. It's just on the edge of the map that we just saw on the other side. And it has 4 hospitals, and I was really sent to 4 different hospitals. I actually have more hospital cards than that, but 4 were the main ones. 5 public clinics, again, seemingly random to me, including 2 different CLSCs that seem to send people, and I never know why they're coming from different places. And 5 private clinics, not because I support private medicine, but because I was forced into that. So starting as a breast cancer patient and sort of as a person who likes to know what's going on, I did a little bit of research. And one of the first things I found was on breastcancer.org, this statement that one of the most important things to do is to keep your whole medical history, a copy of everything, yourself, because no one else is going to have that. And in addition, my sort of 2 breast cancer buddies who had gone through it before me or just before me also told me this was super important. And I actually couldn't understand why people were saying that. Why would the patient have to keep a copy of everything? So what was my experience? What is the current status in 2017 of a breast cancer patient in Montreal? How is the data stored and how is it shared? So first of all, where is my data stored? So where do you think my data is mostly stored? Guess. In what? In a paper file. Very good. Full marks. So I was amazed at the number of places where people are still writing on pieces of paper, putting them into a folder where no one else looks at them, and then eventually the folder is put into a box, and the box for sure is never looked at again. Okay, second place where some of the data is within the hospitals or within a clinic that is computerized, mostly the hospitals. So here I've got a picture of the MUHC and the Jewish General, which are the 2 main hospitals I'm treated at now. Each hospital has a big firewall, meaning that the data inside that hospital is precious. They don't want it out. And within the hospital, actually, there are many different databases, and through our work with our app, we found this out. And even the databases are very much like you talk about your organizational silos. They're the real silos. They're not talking to each other either. Third place that I found was the Dossier Santé Québec, where you can, if you're really persistent, get some of your records. And the fourth place that you might not immediately think of where my data is a data point in a clinical trial. So patients are participating in clinical trials. This is a graph of the clinical trial that came just before the one I'm on now. So the drug that I'm taking, ribociclib, is the blue line, which is better than the red line. So that's good. And the yellow bar is where I am on that graph. So it shows that I'm luckier than 20% of the people at this time in the treatment. And I hope that I stay above the blue line. So how is my data currently shared? So how do you think my data is currently shared? What is the biggest mechanism right now when someone needs to take one piece of my data and send it to somebody else? What's the biggest mechanism? Fax. You guys are good. Fax. And so this cartoon is meant to show what actually happens to those faxes. Second one, much to my surprise, some things are still being mailed around in Montreal. Like, really? And then the third way is, of course, you have some information stored in databases, but how is the information being shared between the databases? Well, not very well, actually. So the dotted lines are to show that there are lines. That is, there are ways in which people sitting inside the hospital can access your dossier santé, but lots and lots of people don't do it, or don't know that they can do it. Okay, so that's the current situation. So what can go wrong? And first of all, I want to tell you I am alive, and I'm talking to you. So the individual clinicians taking care of me care about me, and they do a good job. So the stories I'm telling you now are not to say that the people aren't good, but this is what's happened because my network is not good. Okay, so the first step. So my GP says, Laurie, I've got back your ultrasound report, looks bad. I need to send you to the surgeon. So we are going to fax your stuff to the surgeon, and the surgeon will phone you, and this will happen within 1 to 2 weeks. So what do you guess actually happened? What went wrong in this simple little chain of events? Fax got lost. No fax happened. I saw it go out because I'm careful about these things. I saw her send it, but I don't know where it went. So I'm waiting. Nothing's happening. No phone call happened. So eventually I phone, and 4 to 5 weeks it took now instead of 1 to 2 weeks to see the surgeon. So I figure, okay, the surgeon must have the stuff now because I've phoned, I've explained, blah, blah, blah. I show up at the surgeon's office, and they say, where are your papers? And I said, well, they were faxed to you. And they said, no, we don't have anything. But luckily, I had listened to my breast cancer buddy's advice, even though I didn't understand why, and had insisted at my GP's office to give me a copy of everything they were faxing. Even though they said, no, you don't need this, we're faxing it, this isn't for you. I just stood there until they gave it to me. So I said, it's okay if you don't have the fax, because here's a copy. You can copy mine, but you have to give me back my copy. So we did that. Okay, second one. So I started chemotherapy, 6 rounds of AC chemo, which is really, really awful. And because I'll have to have chemotherapy effectively the rest of my life, they wanted to put in a portacath. So they had to schedule all this. So here what was supposed to happen. First, chemo. Then they do blood tests at equal intervals before your second chemo to see what's happening to your blood. So a bunch of blood tests. And somewhere before the second chemo, I get the portacath installed. That's my portacath. Because I asked for all my data, I can show you the picture of my portacath. So what do you think went wrong on this case? Oh, and I should say that the first blood test was here at the Glen. The second blood test, because I really wasn't well at all, is that they sent a CLSC nurse to take my blood, and then another little guy in a car comes and picks it up. So what do you think happened? They lost the blood. Well, they didn't lose it, but they didn't have the fax number of my oncologist, so they sent it by mail from the CLSC in Montreal. Well, actually, probably St. Mary's, I think, is where this CLSC sends their blood, to my hospital somewhere. We still don't know where that letter is, but a nice CLSC nurse had come to visit me in the interim, actually after the portacath, to see how I was doing. And I said, that blood test, what happened to it? And so she phoned up and said, oh, yeah, we have it in our office, blah, blah, blah. And I said, well, can I have it? And they said, well, we have no way of sending it to you. But the nurse was with a nice student nurse from McGill. And the student nurse says, oh, I'll take a picture of it when we go back to the office and email it to you. And I said, good. So she did that. And she emailed it to me. And then I could take my report to my next oncology appointment. And it turned out, but unfortunately, I had my portacath put in. They used this result, okay, which is, you think, big deal, October 26th, November 4th. But it is actually a humongously big deal when you're on chemotherapy. So my neutrophils here were 4.8, perfectly fine. My neutrophils here were 0.6. That's grade 3 neutropenia. And I'm not at all sure they should have been sticking things in near my heart with white blood cells like that. Okay, second example, I have 6 rounds of chemotherapy. The plan is after 3 rounds, we do a CT scan, see what's happening, and then if everything's okay, another 3 rounds and we see what's happening. First one is done at the Glen. Second one is done at the Montreal General because you just get scheduled arbitrarily to whichever facility has a spot. And the third one's at the Glen. So this first one here, this went okay, and actually the chemo worked fairly well. And then here, on here, what do you think went wrong when we got the report for this third one, based on your experience in the system? What could possibly have gone wrong? No? They didn't have the second result. Right. Why? Because the radiologist has to click a different button on his system to see if there's a report from the Montreal General. And so the doctors all came and said, wow, Laurie, those last 3 rounds, they worked really well because there's this huge delta. And it was only me who looked at the report and had sort of memorized the second report. It burned into my head. And saying, that's not possible. This is, what this report is saying is not possible. And in fact, it was a small delta in the second half. But no one would have noticed this if I hadn't have noticed it, and I wouldn't have noticed it if I hadn't had my records. Okay, so I think I have to speed up. So another point is that it's an unreasonable burden on me to provide data. So people tell me things like, just go and pick up the film, the CD, the reports, all this stuff and bring it to me. I have given my history so many times, starting out with, what is your age? My age is encoded on my frigging RAM-Q card. Right? Like, we could start out with something else, like, nice and sunny outside or something. But, okay. And this one, I don't know if you guys have ever actually filled in these patient-reported outcome questions. But in my study, in the clinical trial that I'm on, I have to fill out a questionnaire, which is the FACT-B questionnaire. It's approved by the various organizations. That's why they use it. And this is one of the questions. And you must answer it. You are not allowed not to answer it. Okay, well, I'm glad I'm getting this reaction because... Okay, so there's a lack of an ability for patients to give feedback about their questions, and there's no access to previous answers, so the patient doesn't get any feedback about their thing, and you can't even know what are the results of the study of this data that you're providing. So patient stored data. So what are the ways of getting data? You can ask, when you go to any appointment, any test, you can ask for a copy. They will say no. You can stand firmly and say, I really need a copy, and you might get it. You probably won't. You can find another person. So when I was in an emergency once, I asked 4 people until finally some really harried resident gave it to me, probably to shut me up. The best way is to say you need a copy for some medical person. So if you're at the oncologist, you say you need it for your GP, and if you're at your GP, you say you need it for your oncologist. And this works. Like, not all the time, but it often works. And then finally, if that doesn't work, then you go home, you print out a form, you scan your RAM-Q card, you fill out this access to information form, and some weeks later, you will get some of your information. How do you store your data? 5, I got it. Yeah. So how do you store your data? This was my first solution, a big box. It was a smaller box at the beginning, but over the years, it's a bigger box. And I tidied it up for this picture. But a better solution is to use infrastructure so that you could... My own personal solution was I used the cloud. I now have a Google Doc of all my important information that's on my phone. And I have a shared Dropbox folder that I share with the clinical studies people. So every time I get a document, they get the document, and we don't have to fill out all these forms. So now we have to think outside the box. Given that inspiration of using the cloud, what do we do? So open your phone and see what you have on there for how do you access your non-health data. You probably have a bank app. You probably have an app to look at your investments and so on. So all sorts of apps are out there for me to access important information that I don't want other people to know, just like health information. So what we're going to talk about now is Opal, the app that we're building to help patients have their information. So what is the common element in the health network? Not your graphs. The actual network is my network, right? I'm the center. So what's the common thing? Me and my phone. I go along all the black lines to visit those places, and I have my phone with me. And when the CLSC nurses come, even though they have no IT infrastructure to visit me, I have my phone. I have the infrastructure. So give it to me. And then we're done. Okay, so let's rethink patient-controlled data through our app. So this is a project co-led by myself, Tarek Hijal, who's my radiation oncologist, and John Kilday, who's a medical physicist. And we have a lot of students and programmers who work with us. It's a patient-centric approach to provide many kinds of data. And this is what the homepage looks like. So you open your phone, and it looks like this. At the bottom, you can click on My Chart, and you go to My Chart, and you get all sorts of information that's specific to you. So this has been automatically taken from the databases and put into your app for you. And so one important thing might be you might want to know your lab results. So you're sitting in the waiting room, you've had your blood test, you're waiting to see your oncologist, you want to know, before you go in to see your oncologist, what are your blood levels so you know what to discuss. So let's say we clicked on lab results, then we would get a screen like this. There are all my lab results. Let's say I want to look at the latest one, which at the MUHC was September 29th. So then we see on the right here, and the guys in red are the ones that are worrisome. So let's say we clicked on the red blood cells because we want to know more about that. We click on there and we get a graph of all the red blood cells counts, and you can see pretty clearly where I started treatment, and you can also see on the here where I had a blood transfusion. And if you scroll down, which I can't do on this picture, there's a link for the patient to go to have information about this blood test that's provided by an organization that makes this information. And so I'm going fast. Okay. Next thing you might want to look at are your clinical notes. So you could click on clinical notes. You get what documents you have. Let's say I wanted to look at my consultation note. I click on my consultation note. I can see when it was created. I can see who added it. I can click on share. When I click on share, I get a warning saying, now this is a medical document. Now this is escaping out of the app onto your phone. Are you sure? So I can say, okay, fine, whatever. I can continue. I can mail it. I can do whatever I want with this document. So I can provide the document now for the people who don't have it. Okay, finally we have education of all kinds. The education is personalized to the patient automatically. So breast cancer patients only get breast cancer information, and they only get it at the right time. So prior to treatment, during treatment, after treatment. This can include videos, or all booklets, or PDFs. And finally, it's completely bilingual, so you can go to settings. And if we do the language, we can set it to French, and then everything becomes in French from then on. So how it works is that we have so I'll have to explain this to you if you're interested later, but the basic idea is everything in gray is inside the hospital firewall, which is protected. We have a double encryption going through a cloud Firebase, which is a Google thing, to your app, and the app has the key. So the patient has the key to their own data. So finally, I am the center of my healthcare network. I should hold the key to my data, and I hope that we'll be able to do it through our Opal app throughout Quebec. That's the goal. And so I think patients can make a difference. That was asked yesterday. Patients can change the system. Okay.